Hey everyone, I'm Melody Johnson. I'm the Director of Education and Professional Development at the Arc of Monroe, and I wanted to share a little bit with you about my journey to get the vaccine. Initially, I was a bit hesitant in getting the vaccine as I have an autoimmune disease, and I was concerned with how that would impact me. However, after a consultation with my primary care physician, as well as my nephrologist, they both gave me 2 thumbs up and encouraged me to proceed, and so I did so. And I've received now both the first and second vaccine, and I'm happy to report I went through both vaccines without any side effects, not even a sore arm. So all I can say is if you choose to do that, please make sure to hydrate, hydrate, hydrate. Big factor in getting through those really well.
My name is Melinda, and my story is I work with special needs adults, and I am also a senior, and I have senior family in nursing in the nursing homes. When COVID hit, I was really afraid because nobody really knew exactly what was going on with it. It was just spreading like wildfire. I really felt because of my health issues, my age, that if I caught COVID, that I would no longer be here. And I didn't want that for my family. I also didn't want to spread it to anybody either. So when the vaccine became available, I had no second thoughts about what I was going to do. I decided I had to take the vaccine. My choice to me was catch COVID and no longer be here, because that's how I felt. I felt that if I caught it, I would not survive it. Or take the vaccine and still be here. So I'm very happy that I took it and that I can now be around the people that I take care of. They will not get sick from me, and I won't carry it to them. And also can go and see my aunt, who is 94, in a nursing home.
Hi, I'm Dorian Adams. I'm the training department supervisor at AHRC Suffolk. I've been in the field for 34 years this year. And obviously we all know that this whole COVID pandemic has been unprecedented. We've never been through anything like this, which makes the whole process to me obviously scary and confusing for all of us. So when the vaccine came out, like most of us, I was hesitant. Nobody wants to be the first on some things, and that was probably one of my biggest fears. Wasn't sure if I wanted to be one of the first group that went through, not sure of the side effects. But I waited out and I started to think about what was important to me, both my family, my job, being connected back into the world that we all were used to. So I decided to take the chance and I did the vaccine. I also felt very lucky to be one of those first few who actually were able to go get it. Side effect wise, a little bit. I had a little bit of soreness in my arm, which I don't think was a big deal. I did have a little bit of a swelling under my arm, but when I looked up everything, it was exactly what they said it would be. My hope and why I really decided to do it was so we can make a change. I feel that we have to do something different. Give us a little bit of hope that maybe our programs will go back. People will be able to return to some sort of a normalcy in their life. And now that I look back on it, I'm proud and happy. I wear my pin whenever I can. And hopefully everybody will take the time to ask questions, do what's right for them, and we'll be able to move forward together as a group.
I'm Dylan Brown. I am a direct support professional for ARC of Oneida Lewis. I'm also a scheduler for ARC Herkimer. And on top of that, I also work for Regional Centers for Workforce Transformation. So I stay very busy, and something I value very highly is my mental health. So when it initially came down talking about getting the vaccine, I was very opposed to getting it because unlike other vaccines, this one didn't seem to have all the years and years of study and research to say that this is 100% safe and we're gonna, it's safe for everyone. So I was very hesitant. So one of the first things I did besides, complaining to everyone that I'm not getting it, I don't want it, was I ended up watching the NADSP webinar about the vaccine, and it really broke it down in layman's terms for me and made me feel much better about getting it. And like I said earlier, I value my mental health, so I do a lot of traveling. I travel internationally, I travel between states, and in order to do that stuff, I feel like there may require us to have the vaccine. So for my mental health, to manage 3 jobs, I felt like it's really important for me to be able to do those things. So I got my first shot last month, and I have my second shot coming up next week. And I want to be able to maintain my mental health. So that was the big reason why I ended up deciding to get it. I encourage anyone who enjoys doing these things to go out and get it. It's better to have it and be able to do them than not get it and not be able to do anything. So
my feelings towards the vaccine, I was totally against it. I felt like because I was able to survive COVID, because I did have it at one point, that I wouldn't need the vaccine. And then I started doing my research, and I just know that this is a time where we're all just nervous. This is something new. This is a pandemic that we did not plan for. My family was against it. I have sick, elderly people in my family, and I decided to be the first one to take the vaccine to show them that there's nothing to be scared of, and it's going to benefit us at the long run.
My name's Christian. I got the vaccine because I haven't been able to see my grandmother in over a year, and she's my best friend. And I, ever since my grandfather passed, I saw her at least once or twice a week, and because of COVID, I haven't been able to do that. It tears me apart. Her being by herself, and I was always there for her, and she's in her 70s, late 70s, so it's hard. And I've always wanted to be there for her, and she's the last grandparent I have left, so it has not been easy over this past year. So that's the reason that I got this vaccine, and for my 2.5-year-old nephew and just my entire family, being able to see everybody again, and that's the day I'm waiting for, is being able to see my grandmother again and spend more time with my nephew without having to worry, and seeing my 90-year-old aunts and uncles and not having to worry about getting them sick and me being the reason that they passed.
Hi, good afternoon, everyone. My name is Javon Steinbergen Bernard. I work for Creative Lifestyles, Inc., where it's situated in the Bronx. We have a great team working at Creative Lifestyle. Now, my decision for taking the vaccine has a lot of components. First off, I want to protect the people that I serve. And in doing so, trying to get back to the way of life that we previously known is one of the reasons I went ahead and took the vaccine. I actually had the Johnson & Johnson vaccine. I did not have any discomfort, really, except for soreness in my arm. And it was good. I was not ill or anything like that. The biggest reasons is because I want to protect my participants. I don't drive. I take public transportation. And as much as I wear a mask, or I use gloves, or I hand sanitize, and I wash, my hands whenever I enter the buildings, I still feel a level that I want to be able to protect my guys more. Even my staff. My staff has been very supportive with us throughout this whole pandemic. A lot of my staff work up to 6 to 7 days a week, doing numerous hours just in supporting our participants. They have families that they have to go home to. So while I'm traveling on public transportation out there, I'm very easily can catch anything and bring it back into my site. That is the one thing that I do not want. I do not want to harm the people that I serve. I love them. I love them very much. They're my other family. So in doing so, in deciding to go ahead and have the vaccine, that was a deciding factor. My mom is also my other deciding factor. She's 80 years old, and I don't want to make her ill either. I want to be able to protect her as well. So, me going out, doing the vaccine, that was my decision. I understand that everybody's going to have different take on a vaccine. And as I grew up in the Caribbean and, taking vaccines at a pretty young age, not everybody's going to respond the same way to a vaccine. Some people might be ill, some people may not be ill, but it's, what it is. And if we want to be, if we want to get well, if we want to go back to the way of life that we know it, at some point, we have to step in and be a part of the fight. We can't just sit on the sidelines expecting other people to do stuff when you're not willing to do something. So for me, my part is to participate and to take part in a vaccine and to be able to say, yes, I did it. Yes, I'm going to protect my family, be it my natural family as my mom, my sons, or the participants that I serve who has become my other family. So that is my decision and why I decided to take the vaccine.
When COVID first started, I heard about it on the news, but I didn't really pay much mind because it was only in one side of the world, or it was said to be one side of the world. So back in November 2019, I bought a little husky, little puppy. It was 8 weeks years old, and she's still, getting older and stuff, well trained. But back then, a new husky training, everything like that, it's a lot of work. And I was also going to the gym due to a diagnosis or being at risk for pre-diabetes because I was overweight by like 50 pounds. I was like 290. I got down to 240 through going to the gym constantly. And it was definitely a major change for me. So, when COVID came around and everything started shutting down, it started with the NBA season and everything just changed. In March, everything changed for me. I got really depressed. And I was watching CNN every day, just seeing all the numbers rise and seeing everything. So the first thing for me, I was thinking I need to get the vaccine as soon as it comes out. And once it became available, I said, what do I have to lose? I have nothing to lose. People smoke every day. People drink every day. People do all type of toxic things to their body every day. So people catch COVID and they pass away. So what's the risk? What's the harm that I could get by taking the vaccine? I wanted to see my family. I wanted to see my friends. And I wanted to get back out in the community. And I didn't want to be the person to give people COVID because I became somebody who literally washed his hands every single second, alcohol in my hands, Purell, anything to try to be somebody that doesn't cause any transmission. So, if I could do my part in the world, I did my part by getting the vaccine in order to try to make things a little bit better for everybody. So when I'm ready to remove this mask, because I feel safe and, even though I got the vaccine, I want to make sure that I'm able to still be supportive and still not pass anything on to anyone. So, vaccine is a thing that you guys should look into taking. I strongly encourage it.
Hi, I'm Louis Cavalieri from the New York Alliance for Inclusion and Innovation. According to the Center for Disease Control and Prevention, studies show that COVID-19 vaccines are effective at keeping you from getting COVID-19. Experts also think that getting a COVID-19 vaccine may help keep you from getting seriously ill, even if you do get COVID-19. But while COVID-19 vaccines can keep you from getting sick, scientists are still learning how well vaccines prevent you from spreading the virus that causes COVID-19 to others. To learn more about the COVID-19 vaccine, please go to the CDC website. Thank you.